We are live.
Good afternoon and a warm welcome to everybody who is there with us today on the second day of this international webinar organized by the Department of Philosophy and the IQAC of East Calcutta Girls College on COVID-19, some ethical and social aspects. I hope everybody enjoyed yesterday's deliberations, and I am certain you will all benefit from today's discussions too. On that happy note, let me now welcome our two resource persons, the eminent speakers of the day. First, I would like to welcome Dr. Kajol Krishna Bonik, public health specialist and epidemiologist, and sir is going to speak on corona pandemic. What is to be done? A very pertinent question indeed in a pandemic petrified world, I would say. Welcome, sir.
Thank you.
Happy to have you with us. And the second speaker of the day is Dr. Riddhi Chakraborty. She is a program leader, health and social care, Global Banking School from London campus. And her topic today is COVID-19 and its ethical aspects. So I would like to welcome Madam too. Madam, I hope you are with us.
Yeah, I am. Namaskar. And good morning from here and good afternoon there. Thank you.
Welcome. We are very grateful to have you with us. So now I would like to request our first speaker, Dr. Kajol Krishna Bonik. Sir, will you please address the participants and share your thoughts? Thank you, sir.
Thank you very much, Dr. Manisha, for your kind word. Good afternoon, ladies and gentlemen. Dear participants, respected faculty members, my dear students, and my fellow co-speaker, Dr. Mrs. Riddhi Chakraborty. Welcome here on this board. First of all, let me start with the very important sentence that today, COVID-19 is not a health issue at all. It's more than a health crisis today. Am I audible by this time? I think I'm audible.
Yes, sir, you are audible. No problem.
I like to discuss the issues. I will cover briefly the virus itself, how it spreads, the epidemiological aspects of the COVID-19, the patient status in and around the world, the efforts already undertaken by different countries and different governments. Some good things are there, of course, with these COVID infections. Some myths are still existing, as well as what is to be done in the next few months or years. Let me start with the very first issue of the virus itself, COVID-19. Basically, it's a coronavirus. And this coronavirus is not a new thing at all. It was there and it is still there. We know SARS, we know MERS, we know influenza. These are all nothing but coronaviruses. At present, we are having 6 different types of coronaviruses. The first 4 causes influenza, and the last 2 we were responsible for, MERS and SARS. This COVID-19, it's a specific new modality added to this corona family. Coronavirus, the name gets because of its structural design. There is a structure at the top of the virus, looks like a crown. That's why it is called corona. Beautiful to see. And that's the dictum is, all beautiful things in the world are not good at all. You have to think otherwise, sometimes at least. This coronavirus spreads through droplets or aerosols. When somebody sneezes or coughs in front of others, these droplets comes out from the noses and sometimes through the mouth when cooking. While we speak, the virus transmits from an infected to some susceptible persons. Very small virus. This virus usually affects each one of us. All of us are equally susceptible to this virus. COVID-19, the name gets because this coronavirus identified for the first time in December 19 in a small town in China, Wuhan, in the Yuan province, and the town is Dubey. That's why the name is COVID-19. Very interesting. So far literature goes, it usually affects more the males. In different countries, different age groups are affected more. In our country, mostly the young adults are affected. But persons having comorbid conditions, particularly whose blood sugar level is high or having hypertension or high blood pressure and other comorbid condition, they suffer most. As because in India, we are having a young populations, so our chance of infections are more, as well as our people are fighting this coronavirus more than other European counterparts. That's also true. The usual presentations of these infections are like any other influenza viruses. Usual presentation of sudden rise of temperature, cough, headache, and little bit of distress or difficulty in respirations. Very, very common symptoms. And subsequently, as time passes by, some of the sufferers, some of the victims do complain of lack of taste or smell sensation. Some complain of pain abdomen, but they are very, very minimal. Usual symptoms are rise of temperature, difficulty in breathing, cough, that's all. We often take it as a flu infections, influenza. So basically, this COVID-19 or the entire group is very simple virus, having a good amount of infectivity. The transmission is very fast, but fortunate that this virus having less fatality. The power or the ability to kill is much less than any other influenza-like viruses, particularly MERS and SARS has proven that their fatality is much more than COVID-19. At present, worldwide data as revealed are showing that the case fatality rate is around 2 to 3%. So these are all about the viruses. This virus, COVID-19, usually gets in our body through our respiratory passages. As I told you earlier, when somebody affected with this virus sneezes, coughs in front of others, certain amount of viruses through the aerosols or the droplets get entry through our respiratory passages, particularly through the nose. But our eyes, our face as such, when some infected hands touches our face frequently, one important point to be noted by the participants, please note that is one study shows as a human being, we on an average touches our face 16 to 20 times per hour. So it's better to avoid touching the face unnecessarily. It's a very easy way to transmit the virus, particularly of COVID. These virus once get entry through the respiratory passages, settles down in different parts of the respiratory tract, particularly the lung alveoli gets affected and people suffer from cough and respiratory symptoms. This is usual, along with rise of temperature, which we call fever. It started its journey from last week of December 2019, but today, 213 countries of the world, they are reporting cases of COVID or corona infections, except Antarctica. Till date, no cases of corona infections reported to the WHO, World Health Organization, from Antarctica. All 213 countries do have cases of COVID infections. Very recently, one important information I like to share with you, that Vietnam has been declared corona-free. So WHO on 11th of March this year declared pandemic. Yes, it's a pandemic. When WHO declared this disease as affecting almost all parts, all hooks and corners of the globe, they term this disease as pandemic. When much more dangerous SARS or MERS were reported in 2003 or 2008-9, they declared that as epidemic, not as pandemic, because coronavirus or COVID-19 affected all parts, all regions of the WHO. 213 countries reported cases. That's why it's a pandemic, and that's the point of apprehension from all walks of life, particularly health segments and economic segments of the society. We are afraid of, we are scared. But friends, dear participants, I am here not to make you scared of this corona or COVID virus infection. Rather, I will equip you with some data not to be scared of. Rather, you must know something about the basic of this infection so that you can transmit that information to your fellow colleagues, family members, countrymen as in general, so that we can fight it together. Nothing wrong in it. Today, this coronavirus or COVID infections, as I told you, has drawn attention from almost all governments of the world, and under the leadership of WHO and the different agencies of different countries' governments, they are fighting against this virus as because the transmissibility of this virus is high. One point in this regard I like to share with the participants that we do consider most important is R0, that means reproduction rate. So far WHO consider, they say that this COVID-19 has a RO reproduction rate is around 2.3. That means once a person is infected, he or she can transmit exponentially to at least 3% in general. That means one person will transmit the infection to 3 others, and these 3 will transmit another 3 into 3, total 9, like this. Exponential growth of infections and transmission goes on with these COVID-19 infections. That's the point of caution for all of us. So basically, our objectives will be to interrupt this transmission, to block this transmission chain. How can it be done? That's the question of millions of dollars. Today, as I told you, India is at the 6th place worldwide so far the number of infected cases is concerned. And as usual, out of about 70 lakhs of people infected with this virus worldwide, USA is at the top of the list. And USA is having the most number of cases, most number of deaths as well. Indians, we are fighting against all these odds. We had our first case reported from Kerala. On the 13th of March, we got the first case reported from Kerala. One medical student returned from China reported positive for the first time in India. Since then, our government, our nationals are united and fighting against these dreadful infections unitedly. And what are the issues that we are taking care of? First of all, we have to take diagnosis. You know, coronavirus infection is usually diagnosed through a sophisticated instrument called RT-PCR, real-time polymerase chain reaction. It's a sophisticated instrument, not available in all places, but hopefully it will increase day by day the number and places, institutions, research institutions, they will have this test done. So through RT-PCR, we diagnose the virus, and The other diagnostic procedures we are using today is TrueNet and CBNet. These were available very much for the diagnosis of tuberculosis cases in different parts in the country under revised National Tuberculosis Control Program. And we are utilizing that facility to diagnose the COVID-19 infections or corona infections in many parts. And gradually, every places, including India, including West Bengal, and in other different parts of the state of West Bengal, we are increasing the number of testing facilities. So number of tests gone up regularly, and at present, we in India are doing more than 1 lakh tests per day. So diagnosis is very important. At the same time, though we are having some applications for different kits to diagnose corona infections, antibody titer in different parts through kit tests, simplified tests without any sophisticated instruments. But till date, Indian Council of Medical Research, ICPR, didn't allow any market for this diagnostic kits. We are hoping that diagnostic kits will be available in our market shortly. If it is available in the market, then we can easily detect the infections or the seroprevalence in different parts of the country very easily with these diagnostic kits. Second issue, after that diagnosis, we require, and the government in different countries, they have adopted the mechanism. And though it's not directly related with medical science, it's to some extent an administrative issue, and different governments, including US and UK, they adopted the policy of locking down you and me, the quarantine, community quarantine called lockdown. By virtue of these COVID-19 infections, people now are very much conversant with this sort of terms like lockdown. When the Yuan people and the Chinese government proposed for the first time, people are astonished. What is going to help? Lockdown means restricting the movements of common people for unnecessary issues or not essential issues. But one of the main points for this lockdown is to purchase time, is to prepare ourselves, is to make our systems in functional conditions so that we can handle the number of cases, number of infections. And as you know, as I told you earlier, this COVID-19 virus is not have any ability to kill once at once. It is very much contagious. The transmissibility is very high, but the fatality ability to kill is very low. On an average, it is said that 80 to 90% of COVID-19 infections are very simple, mild, often even asymptomatic without producing any symptoms. Only 2 to 3% of these infections do require energetical treatment, sophisticated treatment, life-saving management protocols. And for that, we require arrangements of ventilation, oxygen supplementations, and dialysis sometimes. So only 2 to 3% of infections do require this sort of sophisticated management protocols. Through this lockdown, once we try to restrict the movement of others, infected or non-infected but susceptible individuals, not to allow people to mix freely with each other. Through this or during this time, we want to make ourselves able to handle all these issues of diagnosis and management. We have to improve. We have to place our infrastructure in a condition where we can tackle all these issues in general and in the hospitals in particular. So lockdown alone cannot solve our problem. Lockdown is nothing but an administrative measure to reduce the transmission, to interrupt the transmission chain, and to allow us some time so that the health workers, health facilities get trained, get acquainted with the problem, as because COVID-19 is a new subject to all of us, to the entire world community. So we require time, and these lockdown facilities allow us to prepare ourselves ready to handle this infection. I repeat, lockdown alone cannot solve our problem of COVID-19 infections. It requires certain other things, of which most important, WHO has categorically stated that most important avenue to fight against corona infection is to test, trace, and isolate. What does it mean? Test mean WHO categorically said to do effective control over this COVID-19 infection, we have to test at least 1.3% to 2% of the population of a country in general for COVID-19 test. At present in India, we are doing 1 lakh plus tests per day. But as you all know, India having a population of 130 crores require a long time to test each one of us. Similarly, all other countries, particularly the most populous countries of the world, they are having this problem. When we do a test, we get a result either positive or negative. If your result is positive, that particular person has to be accepted as infected or affected with COVID-19. That person requires isolation. At the same time, the person who come in contact with these infected persons do require quarantine. So what is the difference between isolation and quarantine? Basically, it's a terminology used to isolate the affected from the non-affected but susceptible persons. The positive affected persons are put on isolation, and the tested negative persons will be placed under quarantine during the most valuable incubation period of about 14 days, 2 weeks time. They have to be separated from others in quarantine, wherein their movement will be much more restricted. As I told you, during this isolation and your quarantine period, people have to maintain certain rules and regulation of their own so that infection do not transmit further. And that's why very use of certain protective devices we call is personal protection equipments, in addition to universal precautions for prevention of infection and to control the infections, certain other things are very much required to prevent the transmission to spread. Out of that, most important is, of course, we call it SMS. S is for social distancing through lockdown or physical distancing. Initially, when this COVID-19 came up for the first time in the month of January, February of this year, we used to say that this COVID or coronavirus can transmit up to 1 meter or 3 feet. Today, it is documentary evidence that it spreads further. So we have to ask and request the people to maintain a physical distance of about 6 feet or 2 meters because it transmits through aerosol and droplets. Social distancing, the basic term, I personally do not like it. I personally call it as a physical distancing of 6 feet or more is very much essential. Aim for mask. Mask is a must. And not only to cover the nose or mouth, it must be tightly fitted so that certain amount of viruses cannot enter through our respiratory passages or through our mouth. That's most important. Use and disposal of this mask is very important. Everybody must adopt the basic principles of disposing this mask in a very safe way. We will discuss this later. So out of this SMS, the third S is, of course, sanitization. But here the point is too much use of alcohol-based, 70% or more alcohol is not always good to use everywhere. Better, as because this virus is not at all tolerated the soap or soap water, better is to go for hand washing, frequent hand washing. Where soap and water or water are not available, then people may go for sanitization. 70% alcohol-based sanitization is a must. Through this, we can kill certain amount of viruses responsible for this infection. So we have to maintain this SMS, social distancing or physical distancing of 6 feet, use of mask, respirator, or number 3 is, of course, sanitization and hand washing. But along with it, maintenance of carp etiquette or personal hygiene, cleanliness are also important. Recently, certain amount of literatures are coming out wherein it has been documented that this COVID virus may transmit through the anal route, and certain amount of diarrhea symptoms or diarrhea patients may produce this virus. So disposal of stool, particularly of the children, are very much important. So our concern is, and we must all aware, that each one of us, from a newborn to an elderly person of about a century old, are susceptible to this virus. But problem is when you do have certain other comorbid conditions, particularly of diabetes mellitus, hypertension, certain other nerve diseases, you are more prone to develop complications. So in certain parts of the globe, particularly the developed countries like Sweden, America, Great Britain, Germany, France, Spain, they adopted a policy wherein they have asked the senior or comorbid persons not to go freely move in and around. They segregated this group of people to more stringent lockdown. India, since 25th of March, on 24th night, 24th March, our respected Prime Minister declared lockdown entire country from 25th of March for the first time. And after 4 phases of lockdown, we are going to reopen all our activities under Unlock 1. And I don't know how long it will be. From tomorrow onwards, everything will be almost normalized, expected in different parts of the country. Point is, lockdown or unlock, whatever may be the conditions, you have to take this coronavirus as a general entity like all other diseases in our country, like influenza, malaria, dengue. We have to live with this virus. I don't know how far and how long, but we have to maintain all these basic health issues like maintenance of self-distance, use of mask, use of soap, sanitization, and avoidance of crowded places, closed door areas as far as practicable we have to avoid. So basically, COVID-19, though it has caused havoc in the world, so far India is concerned, here the number of cases are gradually increasing. We have not reached the peak till date. We are gradually increasing, and we don't know when the peak of the curve will be reached in our country. As because India is having a population of 130 crores and a vast country, the population density is around 400. So in a vast country, in a populous country like India, it's very much difficult to tackle and to restrict the movement of the people, as well as to check the transmission of this COVID virus. But still, we are doing our level best through different issues, particularly lockdown, testing facilities. At the same time, we are improving and increasing our health infrastructures. We have increased our lab facilities across the country. So far, we spend all this concern. At present, we started with only 2 laboratories. Today, we are having 42 plus laboratories in government and private sectors as well. So we have increased the number of testing facilities in different parts of the state as well as different parts of the country. At the same time, we are increasing the number of beds equipped with ventilators, dialysis, and other facilities, particularly Where supportive treatment through oxygen is required, we have increased that facility. Lockdown period has given us this opportunity to increase these facilities and to make these facilities in place. At the same time, almost all the healthcare workers have been trained to manage how to handle these infections in a proper fashion as per international guidelines. Through Indian Council of Medical Research and WHO, we have trained all the healthcare workers, doctors, nurses, and field workers to suspect, to diagnose, and to manage the cases. Today, all the frontline workers, they are moving in and around to detect the suspect, to identify the suspect, to refer the suspect for testing, and to communicate the test results to the victim or their family members in a manner, in a language in which he or she will understand better and will not be broken mentally. So that's also these mental health issues will be taken up during this lockdown period all over the country. Basically, these COVID-19 infection not only affect the health system, it has gone beyond health system. As you all know, so far the definition of health is concerned as per WHO, it's a state of complete physical, mental, and social well-being, not merely absence of disease. And we do tackle all three components of health: physical, mental, and social. If you consider the physical health of a particular person infected with COVID-19, we get weakness, we get exhausted. So through any other virus infections, and for COVID, it is much more than other viral infections, our immune system has to be restored. Our physical condition has to be improved through diet and exercise. So we have to eat proper diet, we have to do some sort of physical exercise to boost our own immune system. It's a continuous process of fighting between our immune system and the pathogenicity or immunogenicity of the viruses, so that the persons who are fighting better will survive and virus will be defeated. So for the mental health is one of the neglected subjects like any other conditions. In COVID-19, we often forget the persons, not only the person affected with COVID, their family members, their fellow friends and colleagues, their office workers are also mentally disturbed. So depression, anxiety, and suicidal tendencies, all these problems, including denial, are coming up in a very, very large scale. So mental health issues of the victims and their family members much more needed attention from the proper healthcare facilities, including the friends, family members, and other relatives. We must not ignore this issue. So far the social issues are concerned, basically it's an economic issue. Coronavirus infections or COVID-19 has created havoc in the social front. Almost all industries are locked down. Their production is minimized or reduced. Some of the institutions, some of the authorities have stopped payments or giving less amount than usual times. And of course, we cannot but forget this Orija Islamics, the migrant laborers. A large number of people, those who are staying outside of their own native place, are coming to their own native places without any information, without any planning, without any proper arrangement. Suddenly, a large number of people are coming. These migrant laborers, they are also a threat to this transmission of COVID infections. Each one of us has to test these migrant laborers at the point of entry and at the point of exit to ensure the health of the others. And present, after this 3 weeks of migrant laborers movement from their place of work to their native place, now we are seeing the reverse migration. The persons because of their poverty, they are again going back to their place of work. The reverse migration, this is also going to happen shortly, and we have to take these issues very seriously. Now, point is, we have to increase the testing facilities, the healthcare workers, including the community volunteers, has to be engaged to trace, to keep a close vigilance on the persons who are in contact with the infected person, to trace and to isolate in quarantine the persons who have come in contact with the infected one. So we have to ensure a good habitable quarantine facilities with ensured food and other recreational activities, because people, those who are coming from different parts as a migrant laborers, are our own countrymen. We have to ensure that their livelihood, their recreation, their mental health are of our important prime concern. We have to do that. To cut the story short and to conclude, what is to be done in the next few months or years to come? We have to be very much honest to our own commitment. We have to share our information vividly with all others required to do it. We have to maintain the health hygiene. We have to share with all others that if you care for yourself, it's possible to restrict the transmission. At the same time, out of this scared situation, one particular segment may come up with certain misconceptions like Corona Devi Puja. There is no role of any puja, any god or goddesses to cause corona infections, to spread corona infection. It is the activities of the human being that are responsible for this transmission. We ourselves can prevent and control this infection. At the same time, we must not allow the black marketeers to produce bad quality personal protection equipment, masks or PPEs. At the same time, the sanitizers, less alcohol containing sanitizers. Last but not the least, we have to wait for the vaccines to develop, because we have information that around the world, different initiatives are going on to produce vaccine to use against this coronavirus. At least the Oxford University vaccine, CATOX-1, are going to help us. We believe that after the human trial, a large number of people already vaccinated, the good results will come, and we will be able to use this vaccine in a wider scale to prevent these infections. Some countries like Sweden, they are propagating the methodology of herd immunity, but unfortunately for COVID-19 virus infection, the amount of people required to be infected is around 70%. In a country like India with 130 crore population, it is hard to believe that we have to wait till this amount of people get infected in our country to have herd immunity. Or the other issues of monoclonal antibodies for prevention, giving post-active immunity is not at all at present feasible. So we have to depend on the field-level diagnostic kits with immunoglobulin G testing facilities for serosurveillance, and we have to wait for certain vaccines and drugs, as because WHO is undertaking trial worldwide for different groups of drugs, but point is no drugs till date coming up as a most successful anti-COVID-19. Though some sorts of lights are there, and recent controversy regarding utilization of hydroxychloroquine, perhaps many of you are aware of, that certain amount of misconduct in the field of research are also going on. So solidarity trial with 4 groups of drugs under the leadership of WHO will definitely help us to bring some light, some rays of hope for the prevention and treatment of coronavirus in the world. I personally hope that with the increased amount of awareness, and our people will do the best. They will maintain the safe distance. They will use the mask and other protective devices. They will go for hand washing, frequent hand washing, and maintaining cough and other health hygiene properly. We will be able, and nothing wrong in it. We, with our limited resources, limited knowledge, limited income, limited economy, will be able to revert back from these infections, COVID-19. Ultimately, as Indian, we'll win the race. And thank you very much for your patience hearing. If you have any questions, I'm here to respond to your questions. Thank you. Over to Monisha.
Thank you, sir. It was a really very detailed and informative talk, and we got to know a lot about COVID-19. I think some of us had certain doubts regarding certain areas. You have cleared most of the doubts, and if there are questions, we'll have the interactive session when the questions will be asked to you, sir. Thank you, sir. And sir, you have told us all about the use of SNS, the importance of SNS. I think we are going to really obey your dictates, I might say, because these are necessities now. I mean, we cannot in any way play with the lives of countless millions. So what is also very important, which you pointed out, was the physical, mental, and social well-being of the individuals. So this was one very important thing which I think we should all think about seriously. Thank you very much, sir. We were really enlightened by your talk.
Thank you. And I'm here. If you have some questions, I'm ready to answer.
Definitely, sir. We'll get back to you.
Okay.
Now, sir, we'll go back to our second speaker, Dr. Riddhi Chakraborty. And Dr. Riddhi Chakraborty will be talking about COVID-19 and its ethical aspects. So once the two discussions are over, then we'll take on the questions. Over to you, Dr. Riddhi Chakraborty. Madam, can you
hear me?
Yes.
Can you hear me?
Absolutely.
Okay. Thank you. So first of all, I would like to take the opportunity to show my heartfelt gratitude to all the staff of the East Calcutta Girls College, especially to Madam Principal, the conveners, Dr. Shoma Chakraborty, Ms. Panchali Mojumdar, Monisha Sharkar, and all other staff. Thank you so much for giving me this opportunity. And I would like to thank Dr. Banik, because you have you have actually touched and explained a lot more about the health as the concept with the physical, social, and mental health, which is very necessary. And you mentioned about the lockdown, and you touched upon the Corona Puja as well. So a few days back, I was reading an article on all the gods and goddesses involved with the Corona pandemic, who can actually, take the evil out of us. So thank you so much for that. And hopefully it will help me to, build up some concepts for my talk as well. Now, what I will do is I will share my screen with all of you. Can you see my screen now? Is it visible?
No, we can only see you, ma'am. We cannot see the screen.
Right. Okay.
No, ma'am, it's not visible.
Yeah.
Ma'am, you have to click on
presentation. Is it visible now?
No, not yet. I'm sorry.
Right, it's coming. Yeah?
Yes.
Ma'am, you want to share a PPT?
Yeah. I'm just doing it on the full screen now. Yeah? Is it better now?
Right, it is there on the screen.
Okay. Right. So thanks again for the opportunity, and thanks to all the speakers from yesterday and today. that will help me, as I said, that will help me to build up some concepts. Now, when I was listening yesterday and I was going through some of the feedback that or the questions the participants were asking, and I felt that there are 3 building blocks. Okay. So one side is the ethics, the role of philosophy in the COVID-19 pandemic. Then there is the pandemic itself, and then there is the COVID-19. So I thought, why not, work together to build up these on 3 building blocks, and let's build something together to get to know that how philosophy actually can work in this pandemic or can work in any pandemic, and in COVID-19 especially. So that's why I've chosen the topic. And so what I will try to go through, try to give a little bit introduction of the ethics, then how we use ethics to analyze the case studies, the real life case scenarios. And then we will try to go to the pandemics, issues of pandemics, the issues of the COVID-19, and we'll try to see how the solutions and ethical solutions are put forward for the ethical issues of the COVID-19. So all of us will go together in this session. So the basic of ethics is that, as we know, it's a branch of philosophy which actually shows us what is good, what is wrong behavior, what is bad behavior, what is a good behavior. So, and how to know this behavior, whether it's wrong or right. And we talk about the moral outcomes. Yesterday we were talking about the moralities, the mores, the ethics come from there. So, but how do we achieve? How do we know that we have achieved that moral outcome? What values we abide by. So this is what the branch of philosophy, the ethics, actually tell us. Now, as many of us know, and most of us know, that ethics is a normative study, and ethics is actually a prescriptive study, and it shows us how to behave properly, as I mentioned. Now, ethics is generally limited to the human actions. What does it mean by it? It means that it shows us how humans are to behave with other humans, how humans are to behave with other species on the planet. Right? So it can be plants, it can be animals. And it shows us what we ought to do, what we should do, rather than what we can do and what we have to do. So this is a case study. This is about the Swiss giant Nestle, and it has time and again announced that its products are safe to consume. However, in 2015, tests on Nestle India's widely popular instant noodles revealed to have a high concentration of lead, putting consumers at elevated health risks. I'm not sure, or I do not know whether you remember this case study, but it was all about Maggi, instant noodles. So, and it was a big news that time, whether it happened in one part of India or other parts of India, but it was in news, even it was shown in BBC here. So the news was that, like, this is the news and this is the case study. So the instant noodles, a food product, consumed by, adolescents, consumed by many adults, and very popular among the children as well. And it contains a very high concentration of lead, which is very poisonous. So if this is a real life case study, this is a real life issue, then what's the role of ethics in it? What can ethics do? What can ethics try? How can ethics try to solve this problem? Now, if I try to analyze it ethically, so some of the hidden issues that can come out of this case study is that first, the Nestle India that neglected the obligation to maintain the food safety to all. It did cause a harm to the public health without actually disclosing the information about the contents in its food products. It didn't have any open and transparent disclosure, as I mentioned, of the sensitive information that it has a high concentration of lead in it. It didn't respect the consumer rights when I am selling the products and I have to build my trust with the consumer. So it didn't maintain that. And it doesn't matter whether it affected a very small group of people, whether it affected, a very large group of people, but it didn't actually respect the consumer rights. It also neglected or ignored the social responsibility in that sense, which shows that it had a duty to maintain the obligation of the public health. It had a duty to actually promote the safe food, but it didn't do that. So this is how case studies are taken and the issues are extracted from it ethically. Now, how could I actually go to the ethical solutions for it? Now, the basic thing that you got to know that, or you are well aware of probably, that in ethics, we deal with the actions that affect others. And we differentiate the good and bad behavior, good and right and wrong behavior in ethics. But these good and bad are very different from, as you might have known, it's like that good food. That means, okay, I'm satisfied with the food I have on my plate. It's a nice preparation. It's not like that. It's not like that it's a very bad weather outside. It's not like that. So it's a very value enriched terms that we use in ethics, and there is behind it there are certain frameworks and principles that work. The core elements in any ethical evaluative approach are the actions, definitely, as I mentioned, the responsibilities of the agencies, the duties, obligations, intentions, characteristics. Now, and I think many of it actually probably was touched yesterday when we had the speaker speaking about our ethics, compassion, and obligation. Now, but whose actions? If these are the core elements or the core actions we actually focus on any real life issues, any real life ethical issues, then whose actions we actually consider? The obvious answer is the actions of the agencies. Who are these agencies? Now, these agencies are it can be individual, say myself, whether I'm, say, in this time of corona pandemics or COVID-19 going on. So am I maintaining my personal hygiene? So that's my individual agency talking about. Well, it can also, the agency can be a community, the agency can be a society as a whole, the agency can be the government, the state, and organizations as well. So when I mentioned about the Nestle India, so I spoke about the organization's responsibility. So the organization was an agency there. Thinking in this way, broadly, ethics have been divided into different branches again. So you can say there are engineering ethics, there are public health ethics, business ethics, research ethics, teaching ethics, and also environmental ethics, which you have heard yesterday. Now, what are the main existing principles or framework or values that we deal with or we actually focus on for ethical analysis and ethical evaluative approaches? These are consequentialism, the deontological ethics, the social justice or the justice framework, and also we have the virtue framework. Some of the very core values that we focus in all real life issues and also mainly in the pandemic times are the confidentiality, privacy, respect, and fairness. We hint a little bit about the law and ethics yesterday. So and also you might be thinking that, okay, if there is a law in the country, so why do we need ethics? If there is a law in the organization, why do we need to have the ethics on top of that law? So I thought to bring in this slide to say that there is a thin line of difference between law and ethics because the legal actions are involuntary actions, right? But ethics is all about us. How do we behave? So it's all our voluntary actions and our choice, our intention, our motives are very much involved in it. Now, law for the legal actions, it's a set of rules that you have to follow. You have to follow a regulation. You have to follow the codes of profession. But in ethics, it's like the codes of conduct. Of course, it gives you a set of guidelines. The very clear difference that you can see for ethical actions, if you violate those actions, there is no punishment involved in that sense. But in law, in legal actions, if you actually violate all those legal jurisdictions and acts, so punishment is involved in it. Law is needed in the country, in a state, in an organization as well to maintain the order there, to maintain harmony, to maintain a peace. But ethics, on the other hand, it helps people to decide what is wrong and what is right and wrong, and how to act. Okay, but with your own responsibilities, if I can say. Now, legal actions have got a legal binding, but there is no such binding for the ethics. If I try to differentiate a little more in depth, then I get to see that, okay, ethical actions is try to identify the individual needs, whether it's individual health needs or whether it's individual needs within a population or within a community. Ethics always try to respect the diversity, right? So this is a bit of difference with the law. When it comes to the confidentiality, there are action rules for maintaining the confidentiality in the organization, in the state, in the institutions where we work, and that's part of both law and ethics. When it comes to respect the Healthcare Act, so if there is any act, so it's a law. Abiding the Epidemic Disease Act, So probably you have heard of this term now because India actually applied Epidemic Disease Act. So that's of 1897, but it's still applied in for the COVID-19 pandemic. So this is a legal action that we need to abide by. And showing the due and equitable respect, equitable care, that's part of the ethical actions. Now, this is by now I try to give that what is ethics all about and how can ethics actually help us to solve the real life issues and what is the difference between ethical actions and legal actions. Moving onward to the pandemic, so the Dr. Bonik has already mentioned that what is pandemic and how it happens, and he has given the definition, but try to just to revise a little bit. So a pandemic is different from epidemic and endemic diseases. So pandemic happens when there is a simultaneous outbreaks in a large population over a broad geographical area and out of the same disease agent. Now, when it comes to the COVID-19 pandemic, there is a different bug, actually a very new bug in that sense, because people hasn't seen this bug before, has seen the kind of bug, but not this type of bug, if I can say. So in early December 2019, this bug, then that time it was known as the nCoV, 2019 nCoV, or more commonly the Wuhan virus, originated in a fish and animal market in Wuhan, a city of 11 million people in China. But on January 20th, and Chinese officials mentioned that 14 healthcare workers who had treated patients of nCoV, 2019 nCoV, they were ill in Wuhan. So if you can see this timeline, or if you can actually go through this timeline, you will get to know how the pandemic is gradually actually taking the shape of the pandemic in that sense. Now, that's January 20th, and in between January 17th and 22nd, the cases were found in different other countries of USA, Japan, South Korea, Taiwan, and Thailand. So the disease was then going out of China. On January 23rd, the Chinese officials actually implemented the travel ban in Hubei, where the city of Wuhan is located. And by end of January 2020, hundreds of expatriates left Wuhan on chartered airlines. So different countries became very active, became proactive in that sense to take the citizens back from China, back from Wuhan that time. And by that time, it's not just Wuhan, but 4 other different cities or provinces in China were affected. And by that time, the disease was started to be known as the COVID-19 pandemic globally and to be caused by the SARS-CoV-2 virus. Now, if I can show you how actually the pandemic originates, let me know whether you can still see my screen, please, because I want to show you a video. So if can somebody please tell me whether you can still see my screen?
No, madam.
Is my screen visible?
Yes, it is visible.
Yes.
Okay, so I would like to play a video now, but if you can see my screen now, so on the left hand side, this is the number of COVID infected patients as of today. And you can see the list of the countries here. So first is the United States of America, and the number of cases given here. Then Brazil, the situations are really worsening in Brazil. Then Russia, then United Kingdom, and then India, Spain, and Italy, where the cases are in Spain and Italy, the cases are dropping now. But these are the number of cases as of today. And on the right-hand side, if you can see where my cursor is now, there is a cases with the different colors and the numbers given there that less than or higher than. So when I play this video, we will focus on the blue spots, right? Any new cases and how it's going on. So I play the video now and you will see what is meant by pandemic. So if you could see it properly, that few spots originated from China, and then it's so fast and it was very prompt and very quick to infect almost the whole globe. And now at the moment it's spreading to the cases are increasing in some countries, and also it's gradually infecting the African continent. Now I come back to my slides again. So this is how the pandemics we say. So it starts from one country, but it rapidly moves to another geographical location, but the same disease agent, and it causes lots of mortalities and morbidities, that is illnesses and deaths. Now I had this map with me. If the video I wanted to show, or I just shown, if it didn't work, so I had this map with me to show that these are the red spots showing that where the cases have been found and how the pandemic had affected the whole globe. Now, what ethics has to do with it? How is ethics related to it? Now, pandemics or global epidemics, if I am allowed to say that, are public health problems. Right? And it has the huge potential to cause serious harm to the health of individuals as well as to the population. Such harm can be prevented to a large extent or can be reduced very much by appropriate decisions and actions of different agencies. It involves the concept of freedom. This freedom, what does it mean by freedom here? It's a freedom of to maintain the right to health, freedom of myself to exercise my right to health. It's a freedom from the disease. So freedom in this sense. And this is the sense when Amartya Sen is using for the Amartya Sen and other groups of researchers are using for the capabilities approach when they work on the health domain. So pandemics actually also involve the concept of the duties, obligations, and responsibilities. So when it involves these concepts or these obligations, these actions, also in decisions and planning, so it becomes a matter of ethics to plan and implement right decisions at the right time and with justified actions. Now, out of all the major pandemics of the world, especially of the infectious diseases, three major ethical issues have always come out. First is the distribution of resources. I would say the fair distribution of the resources or the justified distribution of resources. So resources mean both human resources and medical resources. Human resources, who are the human resources? You're all frontline healthcare workers. Yeah, doctors, physicians, nurses, other healthcare staff, and also the people who are actually helping you to run the society. Say here I see the bin collectors, our rubbish pickers, right? They actually continue doing that every week. They didn't stop. Our Royal Mail was very much active during this time. Although all the cities were under lockdown, but the Royal Mail continued to deliver our parcels and letters. So these are the human resources. But here I just want to focus on the healthcare workers. Now there is everywhere, doesn't matter in which country we are, but the doctor-patient ratio varies. So there are always the crisis of doctors, there's always a crisis of physicians, and lots of people to be actually addressed to by that lesser number of doctors. As the shortage prevails, so the point is, how are you going to, distribute or allocate the doctors in the places? Which place you want to treat first and which place you want to give the second preference? So this comes in with the distribution of resources. When it comes to the prioritization or triage, the medical persons or people who are working in the hospitals, they are very much used to with this term triage. Now, triage is originated actually from some military actions, but I won't go into the history and detail of it. So when it comes to the pandemic, this prioritization and triage is another problem. So hospital admissions, everybody is sick, everybody is vulnerable, everybody are prone to catch the virus. So who shall I give the hospital admissions? And what about, say, if my hospital is overwhelmed? The place I stay here, and there were two hospitals nearby, but during the COVID time, one hospital, they mentioned that we cannot take any more patients. And as the place where I'm living in is very near to the high road, so we can actually see the number of ambulances increasing day by day and moving from one hospital to the other. It's much reduced now and it's much peaceful now. The same for the ICU admissions. What kind of vulnerabilities shall I look at? Now, the medical professionals, and they will say, okay, we have got, say, CRB 65 tool, or we have a traffic light signal. So if the patients are, like following this is seriously ill, we will take them in the ICU admission. But your beds are limited. So all the beds in the hospitals are limited. So what about the vaccines? So when the vaccines come into the market, who shall I give the vaccines first? Who shall I introduce the vaccines first? Is it my healthcare workers? Who shall I treat first? Who the patients who are having diabetes but are very much prone to the risks of COVID? Shall I treat them first, or shall I treat my healthcare workers first? So these are the issues, or these are the decisions that need to be taken ethically in the organizations and in the governance and in the state as well. Now, when it comes to the duty and obligations of healthcare workers, healthcare workers, our physicians, our doctors, nurses who are working more than 24 hours, they are doing shifts or 4 or 5 shifts in hospitals. And they are basically working in the front line. So when they're doing that, they're doing as per their obligation to the profession. They're treating the patients as per their obligation, right? But they also have the obligation to make the family free of the disease, their own families free of the disease. So I know a couple of doctors here, they actually have stayed in the hospitals. They haven't gone to the homes for 4 months. They were just staying there so that they can't infect the family persons here. Now, when it comes to the public health measures, so we are discussing a lot about the lockdown, social distancing measures and all. So these are the public health measures. So when the public health measures are implemented, so what about the respecting the rights? What about respecting the interest? So these are the discussions that we actually do, that we try to do ethically and try to solve the ethically. Now, how do we solve these? How do we solve these issues? So these issues are solved like, okay, as I mentioned, we have some frameworks, some principles, some values in our hand. So the ethicists, when they sit on the board, or when these issues are put forward in front of them, they actually try to analyze these situations on the basis of these frameworks. Some countries, some organizations might say that I want to go for the consequentialist framework or the utilitarian framework and would like to go for the cost-benefit analysis. I would look for the best outcome, and so that I can take care of the greatest good of the greatest numbers. Some states, some countries, some organizations would like to go by the rule-based framework, which is a deontological framework. And they might say that, okay, I want to just go by the rights versus duties. It's your right, your obligation to do that. And whether the responsibilities and obligation are balanced or not. So they would go by that. People who work with the social justice framework or the justice framework, you can say, they will always go by the equity measures. So what's that? Be it in the planning process, be it in the decision-making time, be it in the process implementation, and be it in the outcomes, they will always try to see whether the equity has been maintained or not. And for the value-based framework or the virtue ethics, they will always try to see, okay, we have these values as our guidelines, and these values are to be maintained. Doesn't matter which decision you are taking, but these values are to be maintained. Now, it doesn't matter actually which framework you are using, but all these frameworks, they try to say that how to be just and fair, maintaining the equality in the plan, in the preparation, in the process, and in the outcome. Now, these are in general from the pandemic issues, but let's go to the COVID now. Just give me a minute, please. Right. So when it comes to the issues of the COVID-19 pandemic, the first and foremost thing, it was a very novel disease outbreak. We knew that it's very much similar to the SARS virus, which actually was an epidemic in 2002, 2003. But we haven't seen this kind of virus before, with crowns on head and everything. So we know the family of the virus, but we didn't know the type of the virus that time. We didn't know the kind of virus that time. This COVID-19 pandemic, I was going through some data that day, and I got to know that it destroys $23 trillion in global market value since mid-February. So it actually caused a huge economic loss for the whole globe, and many countries are going through the recession. Trust me, there is a lot of job actually recession. Not recession in that sense. The government won't say it's a recession, but they're hinting that. But there's a huge number of job losses going on here. and people have started living in caravans in some places because they are out of the jobs now. So unemployment is rising here. Now, when it comes to the public health measures of lockdown, now for China, they led to the biggest quarantine in history. China, if you are aware of it, and if you know that all the bird to animal diseases, the bird flu, then some other kinds of influenza viruses, most of them, if you see in last 10-20 years, they have originated in China. So China is a bit more better prepared than it was during the SARS 2003 outbreak. But still, for this virus, China had to go through the biggest quarantine in history. And it was so draconian, it was so drastic in that sense. We are talking about the migrant issue in India, but the same thing happened in China as well. So it enacted draconian quarantine fully 8 hours after announcing it, allowing perhaps 1 million potentially infectious people to leave the Wuhan city at first stage. And when those people went to some other areas, and then it spread to the other provinces in China. When it comes to India, so India actually lawfully enforced the Epidemic Disease Act of 1897. So that means the government and the state has the power to legally implement the measures, so that if anybody who is violating the measure, that the state has the duty, the responsibility and full authority to take that person under legal obligations. When it comes to the health inequity, that is the disproportionate impacts on health, now in UK, in the United Kingdom, we get to see that the minority groups, the Black, Asian, and other minority and ethnic groups are disproportionately affected. Now, by May 21st, the research data came out that the people from the Philippines, Pakistan, and Bangladesh were worst affected in this country. Many of them work in the healthcare sector. Women within these minority groups, they are most affected as well. But this was as per 21st May. And this was as per the webinar of a Royal Society of Medicine here. But by June, first week, the data came out actually that the Bangladeshis are the worst affected here. And after that, I think the Indians, then come the Pakistanis, and then the other Philippines and other countries, Vietnamese and other countries. Now in USA, the African Americans were the worst hit. So if you can see that we all are vulnerable to this new virus, we are all vulnerable to the pandemic, but some groups are more affected than the others. Now, I think last speaker, Dr. Banik, mentioned about that the men are, more affected than these virus. Yes, men here in this country, I would try to draw the attention and give one example. In the United Kingdom, more men died from this COVID-19 than women. But if you see the ratio, then the women were worst affected in other sense. They faced the domestic abuse, they lost job mainly, but men are better in other sense. But yes, the number of men died from COVID were more than women here as well. Now, what are some of the other issues of the COVID-19 pandemic? Now, when I mentioned about the distribution of the resources, be it medical or human, so we face that shortage, and that's an ethical issue in the sense. So in the UK, by late April 20, actually, government declared, and also because the Doctors Association, they wrote the letter to the government that our doctors, our workers at the front line, they are not getting any protective gears. They are not getting enough adequate protective gears. And then the government declared, yes, we are running short of that. And we do not know how to distribute and who to distribute at the moment. So we are asking you, whatever you have, you just adjust with them. But then gradually, the government started, they started preparing and manufacturing it indigenously. Because why this problem has arisen? Why was it like this? Because China is the world's largest manufacturer of the personal protective equipment. What are them? Your gloves, mask, goggles, the aprons and other gears that you need, to work in the front line. So as China was in lockdown, so the crisis was created in the whole globe. And then if you remember, the India started actually stopped the export of the PPE and started making their own masks. So handloom industry in India, they started preparing their own masks. So that's a good initiative. But no matter how the country is prepared, at a certain point of pandemics, you will face the shortage of the PPE, and then the distribution plan comes in. Now, obligation towards healthcare workers in many countries, from Italy, from China, if you can remember, the first doctor who raised the alarm, he actually died of the COVID, right? That's China. In Italy, even here, so mainly the ethnic doctors of ethnic communities, they actually succumbed to this COVID-19 pandemic. So the point comes in, so what's the obligation of the employers? What's the obligation of the National Health Trust? What's the obligation of the hospitals? What's the obligation of the government? What's the obligation of the trust to protect these healthcare workers? You are asking them to go and do your duty. So it's your obligation to treat the patients. But what about the state's responsibility? What's about the employer's responsibility to protect those persons? Now, in the prioritization and triage, as I mentioned, which is an ethical issue, so many countries actually followed the principle of saving the most lives and saving the most life years. That's United States. In France, they followed the principle of the best chance of survival. So if I know what it means, so if I know that the person will survive this COVID-19 and will live long after that, so they will admit those people in the ICU, but not the others. Okay, so these are some of the principles that work behind these strategies. Now, data privacy, this is another issue coming out of the COVID-19 pandemic. So because many countries are actually implementing the contract tracing app. So what about my privacy? If it's just in my mobile and if my location app is on, my location signal is on, so wherever I'm going, the actually government can have had the surveillance and can monitor my status. I might not want it. So what about that? What about that privacy? So I am an individual in the state, right? So I have the abilities to do my responsibilities, I understand. But what about respecting my rights as well? So these are the ethical issues that come out of the COVID-19 pandemic. Now, how do we solve these? So I give an example here. So this is from the Nuffield Council on Bioethics, and this is about the public health measures. They mentioned clearly, they came up with the guideline that public health measures need to adhere to the ethical principles. What does it mean? That the interventions, any kind of state interventions, should be evidence-based, proportionate, and with engagement from the public. So public need to know, public should have a clear communication that what the measures are, what are the legal bindings of these measures, how they have been implemented, and what will be the other impacts of these measures. So its importance and the public engagement should be clearly indicated in these measures. Coercion, intrusion into people's lives should be minimum, consistent with achieving the aim sought. Yes, our aim is to stop COVID, to delay, to prevent, and now it's to stop COVID, to be aware of it. Yes, that aim needs to be respected, but the state or the government cannot actually intrude into the people's life to maintain that. People should be treated as moral equals, worthy of respect, even during the public health measures, with implemented public health measures. Due respect to individuals should never be forgotten in the way in which interventions such as quarantine and self-isolation are implemented. Solidarity is very crucial while implementing the public health measures, be it at the international level or be it between the governments. Now, what does it mean? In support from the state for those bearing the cost of interventions, it should be maintained properly. The businesses, how they actually maintain their corporate social responsibility, they should have the solidarity with the government as well. So business to business, or the business and government as well. At the individual level, we should also be responsible, and the way we all respond to the outbreak in day-to-day life, we should have a solidarity to the government as well. We should have a solidarity to the community, to the society, and as a whole to the nation. Right? So these are there comes the individual responsibilities and the solidarity as well. Now, how these measures are implemented, which framework they followed, so I leave that on to you to think about. So which framework? Is it social response as T's? Is it the value-based one? Is it utilitarian? Or is it just the rule-based framework? So that's, I leave on to you to think about. And that's all. So these are some of the references, if that can help you. And thank you for listening to me. And I welcome any questions. Thank you.
Thank you very much. It was really very interesting and informative. And we got to know how ethics is also related to this pandemic that we are facing, where especially decisions regarding whom to treat, whom to prioritize in these very difficult times. When that question comes up, it is ethics, which finally, I think, gives the proper answer. And it's interesting you talked about how the minorities are being affected by this pandemic more. And I think you gave us quite a lot of food for thought. It is a very informative talk, and most of us will be thinking about this, about the different aspects that we have taught today, come up with. And I would also like to mention that you talked about a very interesting aspect, that is the importance of privacy of the individual. And this is another issue which is going to come up once the pandemic, the terror, the fear, this gets over. Then these issues will start provoking the people around. So I would again like to thank you for your very interesting talk. And if anybody has any questions, I think it is now time for them to ask the questions to both the speakers. And I will request Payal to please take up from here.
Thank you so much.
Yeah, now we have a number of questions. Am I audible?
Yes.
Okay.
Yes.
Okay, so to Dr. Banik, there are a number of questions to you. First, I'll read out the questions that they have asked to you. The first is from Shomir
One by one.
Odhikari. Yeah, I will ask one by one, please. First is from Shomir Odhikari. His question is, those who are affected by corona but have no symptoms, can they spread the virus to others?
Yeah. It's possible, very much possible, because asymptomatic cases do harbor the virus in their body. And already in our country, about 20% of the total corona positive cases do not have any symptoms at all. They are asymptomatic. So it's very much possible. And that's the challenge for us as a public health worker, to identify those asymptomatic cases, and that at all requires and realize the importance of testing each and every one of us, as all of us are susceptible to this COVID-19 virus.
Thank you, sir, for the answer. There is a similar question. How long an asymptomatic carrier may remain as reservoir host for that virus?
It's not definitely known to us till then, because it's a new subject since December 2019. It all depends on the amount of virus a person is harboring. And recently, Indian Council of Medical Research is working on it, and they are identifying through the RT-PCR machine the amount of virus an infected person is carrying. That viral load, or in other words, cycle threshold value. The persons who are having more cycle threshold value, it's expected that their viral load will be less. The person having more viruses in their body system will be automatically more dangerous to others as well, as accepted usually.
Thank you, sir. There is a question by the same person, Dr. Sanjay Sarkar. He asked, would you be kind enough to discuss something about formite transmission of the virus?
It's not formite, it's a fomite. You know, whenever we talk about the personal habit of coughing or sneezing or even talking, certain amount of droplets do fall on the surfaces like tables, chairs, laptops, mobile phones, door knobs and other things. Yes, very much important question. I like to congratulate Dr. Sarkar for this question. It's very much possible. Yes, because we touch it and if we place our hand after touching a subject, fomites, and place our hands in and around nose and eyes or mouth, certain amount of viruses, they enter in our system and may transmit the infection to us. It has been documented these COVID-19 viruses, they prefer to stay longer times on the porous, non-porous substances like glass, steel, wooden furnitures, but they are less supportive in the porous substances like fabrics or clothes. So up to 3 to 5 days, this COVID-19 virus can survive on the glass surfaces, skin surfaces, and aluminum surfaces, but less in clothes and fabrics. It's better to wash your hand and maintain the SMS as I described earlier. Thank you. Next question.
Thank you, sir. The next question is from Shomdatta Ghosh and a similar question from Gitanjali Mukhopadhyay. They are asking whether continuous wearing of the mask is harmful for health. How long can they wear the mask?
Yeah. You see, there are different types of masks we use, starting from single layer homemade cloth mask to N95, most sophisticated respirator mask. Usually, no mask is recommended for continuous use of more than 4 to 6 hours, but good quality, genuine N95 mask in certain circumstances we have to wear continuously for more than 8 hours. Usually, so long you are with the other subjects, other options, it's better to wear, and as soon as possible to go out from that circumstances, you change it, because sweats and other things gets the marks defective, not effective to control or prevent the transmission or entry of viruses through this mask. Quality of mask is a matter here. Thank you. Next question, please.
So the next question is from Lalita Agarwal. She's asking, you emphasized on social distancing, but in a highly populated country like India, is it possible to maintain social distancing?
I know this is difficult, but not impossible. It all depends on our attitude and our behavior. At the same time, it depends on the initiatives taken by different governments. If we cooperate, if we maintain the social distancing, personal distancing, wearing masks and maintaining our health hygiene and carb etiquette, it's possible to open, because it's not possible to lock down all the activities, all the places for a long period of time. It's already 70 days off in our country. It all depends on our attitude. In this regard, I like to share that attitude is very important. Whenever I talk anywhere, if attitude can be positive, then we can see only the positive things. So I believe people will behave like that. Thank you. Next question, please.
So the next question is from Veena Amrit. She is asking, is using sanitizer continuously good for skin?
Madam, it's not recommended to use any alcohol for hand sanitization continuously. Whenever you require, and require genuinely, like before taking meals, or before and after touching any persons, or any fomites, any substances, any places like your mobile phone, your doorknobs, your laptops, your computers, you must use this sanitizers for use, but not regularly or frequently, but not continuously. It's used frequently, but not continuously. Thank you. Next question, please.
The next question is from Raj Narayan Chaudhary. He's asking, is this social distancing a meaningful phrase, or what does it mean actually?
We never say social distancing, but we have to maintain a sufficient 6 feet distance from or between two persons. We call it physical distancing. At this point of time, we must increase our bonding, social bonding, family bonding, but not at the cost of transmission of this virus. So please maintain a safe distance of at least 6 feet whenever and wherever is possible. Try to learn it from our own experiences. Thank you. Next question.
Thank you, sir. The next question is from Arunima Bhattacharya.
Yeah.
How can parallel treatment of physical and mental ailments other than COVID-19 effectively continue, which is very much disrupted at present and is becoming a matter of very serious concern?
Madam, we do manage cases as a patient, both physical ailments and mental satisfaction together. It cannot be separated out. Our responsibility is to look further inside to bring out the problems, if any, related with the mental condition of the affected person at present or not. It's our responsibility to find it out. What we expect from the common people as an individual to open his or her mouth clearly, freely, and frankly, share your complaints, your experiences, your feelings with the healthcare providers like doctors or nurses, wherever and wherever it is possible. Please share freely, frankly, and completely with the doctors. Thank you. Next question, please.
Sir, she is having one more question.
Yeah,
She wants to know telecommunication without the clinical institution necessary for any diagnosis is pathetically lacking for non-COVID patients. Please, sir, comment on it.
That's a problem for all of us because by giving enough emphasis and importance for management of COVID-19 cases, at present the non-COVID sufferers are really in trouble. Though Indian Council of Medical Research, Medical Council of India, Government of India, and different state government do allow telecommunication and telemedicine. Some of the doctors, those who are conversant, they are utilizing these facilities from a distant remote place over telecommunication facilities. But that's not all possible in different places with all doctors of all these kinds. But I personally believe as the relaxations are going to be implemented shortly from different arena, this problem will be sorted out shortly. Thank you. Next question, you can.
Next question is from Mili Datta. She is asking, is homeopathy treatment effective in prevention of this virus?
I do not personally have any real life experience regarding homeopathy, but I have seen certain advices, guidelines from our Ayush department of government, those who are prescribing, recommending certain medicinal products based on homeopathy for the not for cure but for prevention and boosting of immunity. I personally do not have any practical experience on it. I have not tested this commonly prescribed medicine by this Ayush department by arsenic amendment. I haven't taken it. Next question, you can please.
The next question is, which kind of food can we take to prevent COVID-19?
Where the question of availability of food is in question, it's not subject to be discussed because a large number of population, those who are migrant laborers, are having the problem of non-availability of foods at all. But for us, those who are having some access to good quality food, it's better. I usually prescribe, I usually advise on whatever you are getting within your limited resources, please get you satisfied with that amount. But for prevention of any infectious disease, immunity of your body is required, and for that, any citrus seasonal foods is very good. Besides other commonly taken food like dal, bhat, roti. Whatever we are taking, that's enough. If possible, add some protein-containing foods, seasonal and citrus food during this period. Those who are containing some amount of vitamins and other minerals. That's all. Thank you. Next.
Thank you. The next question is from Dr. Arpita Chakraborty. She's asking, do you think lockdown in India is heading towards a failure in comparison to other countries?
As I already mentioned, lockdown is not an issue of doctors. It's purely an administrative issue, and administration can decide or take it on their own, whether it's a success or failure. I personally believe if you consider India as progress or our activities during this lockdown, I can say that yes, through this lockdown, we can hold the transmission of this virus a bit. However, if you do not have this lockdown, our number of cases maybe today crossed about 10 to 20 lakhs, not 1 or 2 lakhs. So in that context, yes, lockdown has given some sort of positive result to the Indian community. Thank you. Next question, please.
The next question is from Dr. Pranab Kumar Das. His question is, how many types of coronavirus strains have been identified in India, and is there any
Yeah.
change in their infection rates?
A good question. Thank you. I believe Dr. Das is a medical practitioner. If it is so, that's good. As I told earlier, that in India, we have 11 different types of strains identified for coronavirus. And recently, one study came up from CCMB Hyderabad that they could identify one particular strain of A3I from certain parts of the country having less danger, less infective than the commonly circulated viruses in our country. As you know, we get viruses from either Wuhan, China, or US, or from European countries. We usually get today the virus strain 2A virus commonly. That's more dangerous than the recently reported strain of virus from CCMB Hyderabad. Thank you. Next one.
The next question is from Biba Goswami. She's asking, what is your opinion about opening educational institutions?
Again, that's not my headache. That's not my subject. I cannot overstate. But when the entire country, entire business houses are locked down, please don't ask the minor students, delicate students to be exposed widely, as because students, their age itself is a risk factor to go close to each other. And this closeness will be a risk factor for the transmission. It's advisable that it's advisable to keep this closer of the educational institute as far as long as possible, just to prevent, just to ask the students to maintain a safe distance among themselves. Thank you. Next.
And the next question is from Somdatta Bhattacharya. She wants to know, along with clinical issues, the mental health aspect in this scenario is alarmingly significant. Not only anxiety and depression, the panic attacks are frequently reported. Some policies needs to be inherited to promote mental health for public perils.
Right, very good question. Mental health is a neglected subject altogether. Even doctors, nurses, and health workers are not aware fully regarding their mental state. But we, during this COVID, have identified certain areas where definite and specific measures will be certainly taken up by the governments respectively to integrate the mental health issues of any persons in this type of epidemic or pandemics. Particularly, there is a established entity called PTSD, post-traumatic shock syndrome. This is established one, and depression, anxiety, panic, these are all issues during epidemics and pandemics where people get scared of, and definitely healthcare system has to adopt certain policies to at least reduce these events in a common man's life. Thank you. Next question, please.
The next question is from Dr. Sanjay Sarkar. He wants to know, it's being heard that the virus is changing its nature of protein or nature of its spike. Is it proved?
You know, any virus, because they always try to be with us. We know survival of the fittest. We know that even a virus always try to live, and it's not possible for them to live without a living cell. And human body is providing an enough shelter for the viruses to live with. So they are changing their characters, their appearances, just to survive, just to ensure. Because if you consider the fate of these SARS and MERS viruses, they are nowhere now, but not in that particular phase, because by this time, the persons who were infected by these SARS and MERS are no more in the sweet world. They have done. So viruses are changing not for us, but for their own survival. Possible, it's natural. Thank you. Next question, please.
So the next question is from Dr. Rajiv Behra. He is asking, what is the reality behind the issue of the ratio of death or affected between man and woman?
You know, as I told, and Dr. Riddhi Chakraborty from London correctly pointed out, it has been seen and documented that men are more affected and the ill effects of this COVID-19 are much more serious in men. It has been said that because of the extra X chromosome, as you know, females are having double X chromosome and males are having XY chromosome. These extra chromosome is a protective device for the females. At the same time, angiotensin converting enzymes, they are having certain documents that this enzyme is less, and for that, the males are getting more serious burden of this coronavirus. So they are mostly affected, and the complications or seriousness of the infections are much more in males, besides other factors as well. Thank you. Next question, Ikari.
So the next question is, what type of material is good for making a mask?
Definitely, it's a porous. For common people, I recommend 3-layer surgical mask. 3-layer surgical mask is the best. N95 mask is for the healthcare workers, for the persons who are in direct contact, caregivers. But for common people, surgical 3-layer mask is enough. But my submission for the ladies folk, the women folk participants of this discussion, please try to avoid using the orna. That's because you go to back your home with this same dress and put your ornas over your bed even. And please don't use it frequently. Use a disposable one. Don't go for something reusable. It's better to go for single-use disposable material mask. Surgical 3-layer mask is the best.
Thank you, sir. The next question is from Shashwati De Mondol. She wants to know how effective can the treatment of a COVID patient be who remains in the home as directed by the government?
You know, government didn't direct anything. All these guidelines are framed by the certain scientific agencies. In our country, it is Indian Council of Medical Research. They recommend that government implement. Only the mild asymptomatic cases of COVID infections can be treated or managed at home. But cautions are they have to be put under continuous surveillance by some trained health workers or family members, caregivers. They have to observe the affected persons continuously on their health. Is there any symptoms developed subsequently, like rise of fever, respiratory difficulty, discoloration of the lips and tongue, something like this? Immediately they have to report to the health facility. All these things has to be, and most importantly, the person, the virus, and with mild or no symptoms at all should be confined to a particular room. He or she will not be allowed to mix freely with other members of the family. It's better to have a separate toilet and confinement within the same room alone, as far as practicable. Even the caregivers and the affected persons must wear masks, maintain the SMS, self-distancing, physical distancing, mask and soap, water and sanitization continuously, frequently when they need it and require it. Thank you.
So there's a question from Joyitri Vishwa. She wants to know whether there is any possibility of reinfection of a person who has already cured from COVID-19.
It's too early to comment because we do not know how long this antibody of a person who is infected stays in his or her system. It's too early to comment the possibility of reinfections are there or not. Particularly during this epidemic period, it's not possible. It's not so early. It is too early to comment. So hopefully the persons who will be infected today will get cured and certain amount of antibody titer will be developed in his or her body, and we do hope that the immunity will be like dengue infections.
Thank you, sir. There are more questions, so I think you have answered enough of them, and the questions will go on, so you can answer the rest in the YouTube live where they are having their questions. Now, can I move on to Dr. Riddhi Chakraborty?
May I have an opportunity to request you, those who are having any questions, just give my email ID to them or my WhatsApp number. I am available 24 into.
So if you can just tell your email ID, then they can note it down.
Very simple. My name is Kajal Banik, all small, continuous. KAJALBANIK, Kajal Banik @gmail.com. BANIK, Kajal Banik, KAJALBANIK, continuous small @gmail.com. Because why I am giving this email ID and my WhatsApp number is because as a public health person, I believe sharing of information and involving others as a common people for the fight will be most important and an essential element for this COVID infection. Thank you very much. Can I take leave now?
Thank you, sir. Thank you.
Thank you. Namaskar.
Hello.
সবাই ভালো থাকবেন। নমস্কার, সবাই ভালো থাকবেন।
হ্যাঁ স্যার, আপনি থাকুন, এখনো শেষ হয়নি আমাদের সেশনটা। আপনি থাকলে খুব ভালো হয়।
Okay, I will be glad to listen.
না মানে Okay, thank you, sir.
Okay, because I know something about it.
Okay, so now Okay, sir. Now I move to Dr. Riddhi Chakraborty. Hello, ma'am. Can you hear me? Okay.
Yeah, I can hear you.
Okay. The first question is from Dr. Moitri Mukherjee. She wants to know, do you think government and other agencies have some moral obligations to make the deaf and dumb person aware of maintaining the precautionary measures?
Well, very good question, and I'm happy that you actually thought about this because in many countries they are working on these aspects. So because when COVID started, and if you have a pandemic of new disease or new agent, new pathogen, then you do not know that the intensity or the extent of it or what dimension it's going to take. But once it takes its form, then the different research actually takes place and different data then gradually comes out. So here I will give the example from the United Kingdom. So here it got to know that you are asking people to maintain the social distancing. But if a person has the Down syndrome and if a person has suffering from autism, how will you make that person understand that you have to maintain social distancing? So here the local councils, the doctors, and they were actually working along with the parents, those who have the autistic children, those children who are suffering from Down syndrome. So yes, that's the obligation from the government side, and in many countries they are doing it.
Okay, thank you for your answer. The next question is from Somdatta Bhattacharya. She wants to know, lockdown versus economic crisis is actually a moral dilemma. The boundary between harm and beneficence has become blurry. What is the ethicist position?
Well, interesting question. Ethicist position is in between, because ethicists, as their obligation to the profession, they should not take the economist perspective, but they cannot ignore the economist perspective as well. So it should be in between. So how you balance the harm, all kinds of harm, be it economic, financial, social, and mental, any kinds of harm. Yeah, so that's their position is in between.
Thank you for the answer. There is a question from Rajiv Ali. He wants to know, is it ethical to break bikes or cars by policemen to maintain lockdown?
Well, good observation. That's actually came in news, and I went through those articles, and I was, oh, okay. So that's the result of the implementation of the Epidemic Act, right? So when you give the act, when you implement the act in the society, you give the power to the enforcement power to the policeman, to the authorities to imply their powers, right? Here, it's not to offend anybody or not to criticize anybody, but just to give you an example. So when the lockdown started in the United Kingdom, it was a very much liberal sort of lockdown, and it came in news. The policemen were asking the government, right? Many people are not following the social distancing. Do you want us to implement our powers? And the minister said, no, hold on for the moment. Let's wait. Let's observe, because here the natural tendency is to educate the people, to discipline the people from the very young age. So it's also because of the trust that you build with the government and the government's trust with the people as well. So yes, so there it depends on whether you are taking it legally, whether you are implementing the lockdown legally, whether you are implementing the lockdown ethically. So here the law was not that implemented from the very beginning, but gradually they said. But I would say in general, mostly the people listened here. There were some stray incidences and cases, so they implemented the traffic fines. So you cannot actually go to this place, or if you are going to this place, then you have to fine. Or if you are, not following the rules properly, then you will be fined for this. But that's mainly with the traffic. Other than that, the legal enforcement that is in some countries, say in China, it's not just India, but in China it also happened. It's so authoritarian, and they were said that okay, so we are implementing our legal rules. So those who are, say, with the Wuhan number plate, you cannot go with the car to other cities of China if you are having the Wuhan number plate. There are many migrant workers who actually went to the city to work, and they actually go back to the rural China to, during the festival time. And this time they couldn't. They were just stranded, and they lost the jobs as well. Because most of the China, I have Chinese colleagues, so I was getting to know the informal stories from them. So what's happening inside and what they were sharing in the social media. But then say the Chinese government, they actually blocked all the social media sites so that the Chinese inside the country, outside the country, they cannot share those materials, what's going on inside. So that's the legal enforcement. But if everything has to be legal, then what about respecting the rights, the human rights, the fundamental rights? That's my question. I hope you have answered. I have addressed the question.
Yeah, thank you for the answer. There is one more question from Nipin Mondol. He wants to know by what way migrant workers can get social justice.
In what way? Interesting question, sir. In what way they can get the social justice? It's ethics come in also with the capacity building. So when you are building your infrastructure, so you need to have a proper infrastructure setting up. Thinking about all these, what can happen, thinking about the risk assessments or the potential risks that can come and affect the society. Now, I would like to mention here that a pandemic just doesn't come all of a sudden. Okay, it's happening in some other country, then it comes and affects other countries. So you get some time, our country gets some time to prepare for it. Now, but no matter how the country is prepared, there will be some issues out of the new diseases. But a pandemic, we actually call it pandemic, but a pandemic plan, or if you see the pandemic preparedness, it has got three phases. One is pre-pandemic, another is pandemic, another is the post-pandemic. Now, the migrant issue in India, which the whole world is actually looking at it right now, because it's everywhere on the news. When you switch on television, you can see all those news there. So the point is, you learn from the mistakes now. You build your capacity after the post-pandemic phase. At the moment, maybe some ad hoc capacity building should be there, or ad hoc measures should be there. But you learn from the mistakes now, and in the post-pandemic phase, you work on that, and then you actually, hopefully by next pandemic, that won't be repeated. Want to mention one small thing here. So you mentioned about the migrant workers. Now, if you know about the handloom industry in India, so there are a couple of migrant workers working there. So many NGOs actually they came up with the initiative so they can actually be, and the handloom industry is totally stopped and it's actually going through the loss like many other industries in the country. So different NGOs, Tata Trust, they came up with some initiatives and they are helping those migrant workers so they can sustain through this pandemic and after the post-pandemic as well.
Thank you for the answer. There is a question from Pradhan Shaw. How is it possible for downtrodden people with marginal housing facilities to maintain physical distancing?
To maintain physical distancing, well, it's about. Well, yeah, that actually came up, if I can say, that question actually came up not just for India. It was actually in Japan. The houses are so small, so they were worrying about it as well. I was listening to one webinar that day and it came up from there. But somehow the immunity and everything Japan control because also they have very disciplined and very strict in their rules as well. So if I think about the small household, so it's like if you are living with the people of your own household, it's fine. As of the nature of the virus, that was the instruction here. So if you are living with the family members who are living with you in the same household, it's fine. Probably you do not need to have that social distancing. No need to mention that. If you have comorbidities, you have to be more careful. Say not eating on the same plate which others are using. You maintain your personal hygiene, take regular baths, wash yourself. But if the social distancing comes when the people from your, another household are interacting with you, so that can be done. So when our delivery people or the bin collectors, they were coming, we are just talking from inside the house and just waving the hand, okay, drop the parcel outside the door, we will collect it from here. That's how we were doing. So I think it's problematic, but if there is a will, there is a will. So you were asking that in slum area, how it can be done, because there is how social distancing can be maintained. Well, if you have got one roof over your head, so try to maintain stay inside or under that roof. Do not try to interact with your neighbors for the moment. Let this virus die down and then you can. Or if you are actually going outside of step outside of your house to interact with the neighbor, maintain the 3 meters, 6 feet, the distance. That's what I can say. But I think Dr. Monique can hint more on it. But that's my observation goes. So thank you.
Okay, thank you for the answer. The next question is from Kamul Shorkar. He wants to know, ma'am, do you think that the nomenclature migrant worker is ethical?
The nomenclature, right, of the migrant worker. Right. In one sense, yes. In one sense, no. In one sense, yes, because your permanent address is somewhere and you are going to work somewhere else. So say I am a migrant here. So I'm a migrant from India to UK. So I don't feel it bad. So it's okay for me, right? I'm working here. I'm living here. So it's fine. It works for me. But and in other sense is that migrant, that depends on your what kind of fundamental rights that it's been maintained there, and how you have been looked, whether you are looked at like with a racial perspective, or you have been stigmatized or what that. So if you are using that term or that word for all those purposes, then it's not good. But otherwise, if you are thinking about my socio-demographic status, it's okay. I personally do not have any problem with that. And it's an issue. So why not discuss it with the issue? If I remove that nomenclature from the migrant, that issue might die down. So why not have that nomenclature and work on it so that we do not repeat the mistakes again?
Thank you for the answer. There's a question from Obhirup Ghosh. His question is, ma'am, COVID-19 has given rise to anti-Asian racism and xenophobia in several countries. Do you think that international laws rather than national ones can be implemented to prevent such incidents?
Well, there comes again about the law and ethics. So I will stick to the ethical side again. About the legal side is about the human rights law. You cannot discriminate any person. So it's not good, or it's not fair. It's not justified to discriminate any person on the basis of the color, creed, or the geographical origin. So you cannot do that. So that's definitely, it comes under legal aspect. But whether international law has to be implemented all over the country, that's up to the state governments.
Thank you, Dr. Riddhi. You have almost answered all the questions that the participant have asked. Thank you a lot for answering the questions and for being
Thank
with
you.
us. Over to Monisha Di.
Sorry, Ms. Pakrashi, if I can ask, mention, there are two questions I can see in the chat box. Can I reply to them?
Okay. Yeah. Please.
Right. Thank you. So one question is about how we can, it's from the Gangana Bose. It's about how we can relate utilitarian ethics to COVID-19. Well, it's in the PowerPoint slide. Also, if you can see that just to give you one example to understand. So the United States, their prioritization and triage policy is to save the maximum number of people. Right? So that's an utilitarian ethics that's coming in. That's for their hospitalization, and probably they would follow that for the treatment on the vaccine when it will be in the market. So that's how we can relate the utilitarian ethics. So the companies, the organizations, when they're doing the cost benefit analysis out of the COVID-19, they are following the utilitarian ethics. So that's how we can relate. So that's Ms. Bose's question. And another is Rupashri Nayak's question. It's how do we overcome our mental stress? Right. Interesting question. Yes, we need to focus on the mental health side as well. How can we overcome our mental stress? It's up to individual. It's up to us. How can you actually do that? Do more yoga, do more meditation, utilize your time, whatever free time you are getting, do that. Have one sort of physical exercise that at least a day. So it will be better to do that to ease the stress. And also I would like to mention here, I got to know that West Bengal government is actually on this mental stress of the healthcare workers. So clinical psychologists are going to the hospitals and working with the healthcare workers, working at the front line and working on how they can ease the mental stress. So the work is going on. It's not that there is nothing there. The work is going on. But I think Dr. Burning again can, because he is in that health system, so he can answer better on it. So thank you. I think that's all.
Yeah, we have some more questions, Dr. Riddhi Chakraborty, in YouTube now. So can I ask you the questions now?
Yeah.
Okay. The one question is, why in UK men are more affected than women?
Well, it's why in UK is the study is still going on. The probable causes may be, the smoking habits. Probable causes may be the Asians are more prone to diabetes here, right? So like that. But why men in general all over the globe actually were more affected than women. But in some places, if you see the ratios, the other effects were more on women than men. Number of men died from coronavirus is huge amount than if you compare it with the women. But why in UK especially, it's, I do not know. It's that the research is still going on.
Okay, we have a similar question from Priyanka Hajra. Her question is, ma'am, what do you think about the reasons for getting infected, men infected more than women?
Yeah, as I just mentioned, that personal habits, right? So that is one probably. So how you maintaining your personal hygiene, that is one mainly. And also the smoking habits, your comorbidities, whether the persons are having more diabetes or other, heart disease, lung disease. So some of the diseases are more in men in the whole globe, right? So these are the comorbidities that are affecting the men more during the COVID than women.
Thank you for your answer. There is a question from Nazrul Islam. Do you think from the ethical point of view that India has taken different measures to combat COVID-19 pandemic as we observe many fallacies during Janta curfew till date?
Well, I am nobody to judge the government. in that sense, if I can say so. Right. Whether India has taken the appropriate strategy or not, that will be seen or that can be evaluated in your future when the coronavirus pandemic is over. But the early lockdown phase, the proactive initiative is very much appreciated, right? So even we think that even in Great Britain, they should have actually implemented the lockdown 1 week ago. If they have done that, probably number of cases would have been low. But our Prime Minister here was saying that, okay, he was a bit liberal kind of person, and what he was saying that, okay, I request you to do that. And then from later on, a week after, it became, I ask you to do that. So these are the words we actually follow. So I request you and I ask you to do that. When it's asked, that means it's a sort of command. So you have to stay at home, right? You cannot go to work. You have to do the work from home. So fallacy and otherwise, so fallacies are everywhere, right? If you see that every lockdown has different fallacies, but how you overcome it, what strategies you actually learn from it, and how you implement it next time, that's a big issue, and that's we should focus on rather than criticizing all the initiatives that the government is taking.
Thank you for your answer. There is one more question from Rajnaran Chaudhary. He is asking, how can we conquer ego in this lockdown period?
Well, my background is not psychology, so I'm not sure how I can address that. Ego of what? The question comes, ego of what? My personal ego that I can't go and meet my neighbor? That should not be there. So if I have to say hello to my neighbor or hi to my neighbor, I can just stand in front of my door or can stand, beside the wall, and I can say, okay, hello, I can talk from there, maintaining the social distance. Now, these kinds of pandemics are very serious. It depends on how seriously we are actually taking it, how seriously we are conceiving it. Now, this pandemic is about saving ourselves first, and then saving our family members, then saving our community and saving our society. So if the ego comes there, right, so we cannot work in this way.
Thank you for answering the questions. Hello?
Yeah, I said that I tried to answer, but I'm not a psychologist, so I can't probably answer that question exactly. So thank you.
Thank you. There are many more questions. I think we have to stop somewhere. So I think we should stop now, and over to Monisha. Hello.
Thank you very much. Thank you, Dr. Bonik and Dr. Chakraborty. This really was a very productive interactive session, and you both patiently heard and answered all the questions which were forwarded. Thank you very much for conducting this session so smoothly. And now I would like to...
Congratulations to you, Monisha, because you conducted the session. We just spoke out of our mind, myself and Dr. Nidhi.
Thank you, sir.
Thank you very much.
Thank you very much. Thank you very much, sir.
Congratulations to all the participants.
Yes, sir, definitely. They are, I think, there and they can hear you very well. And of course, without the participants, this would not be a successful webinar. So going forward with the program, so we will now ask Dr. Deepa Ghosh, Associate Professor from the Department of Economics, East Calcutta Girls College. I would like to invite her to deliver the valedictory speech. Over to Deepa Ghosh. Madam, please. Can you hear me?
Yeah, thank you, Monisha.
Yes.
Am I audible?
Yes, absolutely. No problem.
Because I have some network issue right now. Okay.
No, you are very
thank
clear.
you. Yeah. So good afternoon to all the dignitaries, all the participants and my colleagues. We have actually come to the end of this 2-day international webinar on COVID-19, some ethical and social aspects, organized by the Department of Philosophy and IQAC of East Calcutta Girls College. Now, yesterday the program started with the welcome address of our principal madam, Dr. Shukla Hazra, where she highlighted the problems of the so-called migrant laborers faced in India and the need of providing proper treatments to them who are so far being treated as untouchable, as she mentioned. After her speech, Professor Bashut Chaudhuri, the Honorable Vice Chancellor of West Bengal State University, delivered his inaugural speech where he pointed out how during this lockdown situation, because of this lockdown situation, how India could save its own people at the cost of its economy. Describing the social and ethical issues of this COVID-19 pandemic, he said that since large number of establishments have been closed, it is necessary to provide some kind of social security to these distressed people. We, the human beings, therefore must come forward to take responsibility in maintaining the norms related to health and hygiene, which have been established by the government. Quoting Rabindranath Tagore, he emphasized that we must go beyond ourselves to take care of not just our family members, but everybody around us. The next presentation was by our IQAC coordinator, Professor Panchali Majumdar, who presented the theme of the webinar. She rightly pointed out that during this lockdown situation, how the air and water pollution has come down. She put stress on the collective solidarity, which is the need of the hour at this moment, and how to help the people in distress. Next, the keynote address of the webinar was delivered by Professor Ramesh Chandra Sinha, Chairman, ICPR MHRD. According to him, ethics is concerned with the norms of the society, which in turn are concerned with the values, which again depend on interpersonal relationships. During the COVID-19 pandemic, a new normal arises, which according to the speaker consists of three components. Survival, the most essential component of it, the social distancing, and the compassion, another major component of this new normal. The compassion organ, again, according to him, consists of empathy and sympathy. The socially and economically marginalized people need the compassion of others. We can extend ourselves through the services to others. Professor Sinha emphasized that the ethics or morality is what we need to live in the new normal world. He ended his address with the hope that we survive and excel in this new world.
Hello.
Yesterday, in the technical session, the first speaker was Dr. Abhik Gupta, Pro-Vice Chancellor of Assam University. He looked at the COVID-19 from the perspective of an ecocentric orientation. In his presentation, he said that the scientists have made theoretical predictions beforehand about this eco-philosophical crisis. He gave us an overview of different types of zoonotic virus infections that have hit the world in different time periods. In some cases, the origin was a bat species, or in some other cases, some species of pangolin. He said that there is widespread trade of wildlife for the meat, the scales, medicines, and etc. To reduce such trade, he said, regional cooperation, widespread awareness, as well as livelihood supports are required. Because actually many of the species are getting extinguished, the ecosystem like the rainforest, grasslands, wetlands, and rivers, etc. are getting destroyed. The solution, according to the speaker, is to take ecocentric approach. So what is required is to conserve the animals, not just the endangered ones, but also the less spectacle and the near threatened species. We need to protect them outside our protected areas and beyond the prioritized species, and hotspots. He mentioned that air, water, and soil quality have improved and wildlife have been entering inhabited areas, taking the advantage of human confinement. The holistic approach must include provision of some therapy, psychotherapy to the distressed people, to the depressed people. Also, he said that the other provisions can be ensuring local food security and so on. He feels that planetary philanthropy is required from the developed nations if we need to survive as Homo sapiens. He ended his lecture with the hope that more ecocentric, more nature-centric ideas will be incorporated in near future to combat the situation. In the second technical session of yesterday, the speaker was Dr. Sushim Dubey, the Program Officer, ICPR MHRD. His topic was COVID-19, health concern, philosophical counseling, and yogic practice. He has mentioned in his lecture that after India adopted the policy of liberalization since 1990s, the erosion of ethical and social values started. There were problems of values, the problems of integrity and corruption. And due to this eroded social values, human beings started to become self-centric with less concern about others. He feels that revival of morality is required. He further discussed the benefits of philosophical counseling and yoga practices, which include both asanas and pranayamas, which can boost up our energy level. He also mentioned how reflection helps the people to get when they get disoriented. Today, we have started the technical session with Dr. Kajal Krishna Banik, the public health specialist and epidemiologist. His topic was Corona pandemic, what is to be done? He started with the features of the virus, COVID-19, and how it affects the human body and what are the symptoms of the disease and so on. He told us that the reproduction rate of the COVID-19 is somewhere around 2.3, though the fatality rate is quite low. So the objective should be to block the transmission chain, and it needs to be diagnosed first, though he said that the kits are not available in the markets. Then what he's emphasized is on the quarantine and the lockdown, which restricted movement of the people. But it can't solve the problem alone, he mentioned. It only allows the authority to get prepared to fight the disease. So the most important avenue to fight, according to WHO, is to test and isolate. The isolation also has certain norms to be, during isolation, certain norms to be followed or maintained. He mentioned about the SMS, the social distancing, the masks, and the sanitization or the hand washing with the soaps. The maintenance of physical hygiene is also required. With comorbid conditions, the risk factor increases, we all know. So we have to live with the virus. How long? Probably is not known to anybody. The testing facilities, the availability of beds in the hospitals, the ventilators have increased during the lockdown. All healthcare workers have been trained to tackle the disease. COVID-19, according to the speaker, has physical as well as some mental health issue. The affected people suffer from depression. As we all know, probably we are also have all experienced it. Now, on social front, he said that all production have virtually stopped due to lockdown, and there is problem of migrant laborers. He concluded his lecture with a note that we must take care of ourselves to combat the situation, and ended with the hope that the vaccine of the disease will be invented soon. It was truly a very informative speech. Now, the last speaker of today's session was Dr. Riddhi Chakraborty, Program Leader, Health and Social Care, Global Banking School of London campus. Though I must admit that I could not follow full of her lecture due to some network problem, but whatever I have heard, she started actually with what defining what ethics is all about, and then she went for a case study where the instant noodles Maggie, which is supposed to have a high concentration of lead, and she described how the Nestle India neglected the obligations and its responsibility. According to her, the core elements of ethics are the actions, responsibility, or duty or obligations, intentions, characteristics. She described about different branches of ethics, how ethics can help us to resolve different issues in life. She also distinguished between law and ethics, how ethics help us to resolve these issues, how it is related to the pandemic, that also she discussed, which involves duty, obligation, and responsibility and actions. She further described the three major ethical issues of the pandemic: the distribution of resources, the prioritization, and the duty and obligation of healthcare workers to treat, and the public health measures and balancing rights and interest. To solve the issues, some frameworks also she talked about, like consequential, deontological, justice, virtual ethics. So all over, it was a very enriching, engrossing, and informative session, the two-day session. Hope all the participants have enjoyed a lot and could enrich themselves. So thanks to all the speakers, all the participants, and thank you all. So over to Monisha again.
Thank you, Dr. Deepa Ghosh. It was, you've summed up the various sessions of these 2 consecutive days in a nutshell, and you did it very precisely. And I think those who might not have attended any of these days' sessions will get a fair idea from your summing up. Thank you very much. And now I would invite Dr. Panchali Mojumdar, IQAC coordinator, to please give the vote of thanks.
Thanks,
Dr.
Monisha. Yes.
Yes.
Yes, Monisha, can you hear me?
Yes, I can.
Hello?
We can. You are very audible. Thank you.
Okay. Thank you. Now, it's a matter of pride and pleasure for me that I could express my heartfelt thanks in front of such an intellectual audience. Now, at the very outset, I would like to thank Dr. Mrs. Shukla Hajra, Principal, East Calcutta Girls College, without whose encouragement we can't do this type of webinar and we can't enrich ourselves. So many thanks to Madam. When we were talking about to organize this type of webinar, she talked to me that Dr. Shoma Chakraborty is willing to do such a type of webinar, and we were happily agreed and tried our level best to make it success. Now, I would like to express our thanks on behalf of the organizing committee to Professor Bashuk Choudhury, Honorable Vice Chancellor, West Bengal State University, who extended his hand to make success this webinar. I would like to thank Dr. Ovik Gupta, Dr. Sushim Dubey, Dr. Kajol Krishna Boni, Dr. Riddhi Chakraborty as a resource persons that they have enriched these 2 days webinar to make a success one. The lectures enriched us in a whole way. In this time, when we have to engage the society as a whole in a real and effective approach of responsibility and solidarity, because the fight against an epidemic must be a concern for everyone, not just experts and medical professionals. It's a fight for all of us. And in this regard, we need collective solidarity. In this regard, I would like to give my thanks to on behalf of the organizing committee, I would like to give my thanks to all the teachers of the East Calcutta Girls College, all the faculty members, all the non-teaching staffs, and our students who are always with us when we organize all these webinars. Actually, in the past situation, when we were organizing not this type of webinars, but organizing seminars, our students, particularly our NSS volunteers, played a major role in doing these seminars. But now we feel their absence in physical terms, but they are with us always, keeping them in track through online modes and through other ways. Okay, now at last I would like to thank Sri, all the members who have helped a lot, particularly the technical side who have helped us, Proyush Parimu, who has helped us from the very beginning by doing a demo version so that we can do it in a proper way. Now, I would like to thank Dr. Shoma Chakraborty, Department of Philosophy, Assistant Professor. She is the first one. When we were thinking about the webinars and talking to Madam that we have to conduct the webinars during this COVID-19 period so that the quality enhancement can't make a full stop. We have to go ahead, and at the same time, we have to aware all the people regarding this COVID-19 period, what to do or not, and what are its various aspects. Dr. Shoma Chakraborty was the first one who extended her hand to do this type of webinar, and she said that I will do this. We, the Department of Philosophy, along with other teachers, we will do this type of webinar, and she always extends her hands. I and Dr. Shoma Chakraborty, both of we were the NSS program officers. Until then, it was the time of 2010. Until then, she was engaged in every sort of extension activities, every sort of voluntary service, so that we can combat any situation and aware our students so that they can also extend their hands in the community development. Thanks to Department of Philosophy, Dr. Payal Pakrashi, Dr. and Srimati Dolon Ghosh, who has also given their best effort to make this webinar successful. My heartfelt thanks to all the members of our institutions, all the participants who have joined these international seminars, and they are the main people who will spread the message of these webinars that is the ethical and social aspects to the many people, so that the other people may aware about the facts and they can also spread this message to everyone. In this time, we are getting the worldwide, particularly this current pandemic epidemic is probably the first to be experienced worldwide in real time in the age of 24 hours news channels, social media, and live broadcast. Many of us are aware, but we have to spread the awareness among the general people. We, the people who have the advantage of doing this, to aware the people, to make it a successful one, so that we can combat with the pandemic and we can see the ray of hope in future for our future generation, because they will say the last word that we shall overcome. We must overcome. We shall do. We must do. We must do it for our Mother Earth. And I hope in future, all the resource persons, sir and madam, all of us has enriched us a lot. And I hope that in future, nowadays, we have to maintain the social distancing in terms of physical distancing, so that we can make ourselves safe and healthy. But in near future, we must overcome this situation, and mentally, you must be with us so that we can combat this situation and can overcome all sort of difficulties in near future and hope for a bright new ray of light for the future. Thanks to all of you. Thanks to every participant, everyone who extended their hands to make it successful. We are very much proud and feel privileged that we have you with us. And I hope in future you will be with us and we will be with you. Thank you. Thanks to all of you. And last but not the least, I would like to thank Dr. Monisha Sarkar, who has coordinated all these seminar webinar, all the sessions in such a manner that all of we have enjoyed it very much. And Dr. Monisha Sarkar is of English Department of East Calcutta Girls College, Assistant Professor and HOD. And I would like to thank Monisha a lot. Thank you, Monisha, for conducting this webinar in a successful way. Thanks to all our respected resource persons, our respected principal madam, without whom we can't do all these things, and all our non-teaching staffs, all our students, so that we can overcome this situation together. Thank you. Thanks to all of you. Over to Monisha. Monisha?
Yeah, thank you. Thank you very much, madam, for your kind words. And now we come to the conclusion of the 2-day international webinar. I hope everybody enjoyed, got themselves enriched, and we are all now taking home information, new ideas, new way of looking at this pandemic. We are to equip ourselves to face the pandemic and get ready for a world which now has a new word added to it, that is new normal. So let us together fight this pandemic. Thank you very much.